Hello and welcome back to another Future Doc House production. Let's talk about Staphylococcus Part 3. Here we go. I left this on the board so that you know what, this is kind of the overview of what we're going to talk about. These are the diseases that this bacteria can cause. And we're going to start with toxigenic toxins, okay? Because these will show up on the board, and that's why I'm talking about it. And I know this is pathology, and I know this is infectious disease, but infectious diseases is not just about the bacteria, it's also what the disease that this bacteria can cause. Here we go. Pathology. Gastroenteritis. Mayonnaise. If you will get a question on the board about a patient eating mayonnaise, and which included this bacteria that led to the toxin, the enterotoxin, which causes the which stimulates the peristalsis of intestines, leading to diarrhea. And the symptoms are simple: nausea, abdominal pain, and fever. And this is usually less than 24 hours. Within 24 hours, if you eat something, most likely mayonnaise, and you get diarrhea or nausea and all the other symptoms, think Staphylococcus. Toxic shock syndrome, TTT. Super absorbent tampons, toxic shock syndrome. This toxin causes the release of TNF alpha and interleukin 1. I mentioned this in a previous video. These are cytokines, and they basically make your body's immune system go crazy, go haywire. Other patients other than tampon patients, even though that's the favorite one on the board exams, are infected sutures, abortion, and childbirth can lead to toxic shock syndrome, an infection by Staphylococcus leading to toxic shock syndrome. The symptoms are palms and soles undergo desquamation, septic shock, frank shock, ARDS. What's ARDS? Acute respiratory distress syndrome. That's what ARDS is, and acute renal failure. So you get a patient like this, think staph infection. Staph scalded skin syndrome. Exfoliative toxin A and B is the toxin, and it usually happens to neonates with the umbilical cord that was cut off, and they get this infection, or children with skin infections. And the toxin causes cleavage of the middle epidermis. You must rule out Stevens-Johnson syndrome. It's a drug allergy, okay? And it comes off very similar to staph scalded skin syndrome. Pneumonia. Okay, 1, 2, 3. So here we go. 1's here. We're going to talk about pneumonia. 2 is here. We're going to talk about, I think, abscesses, especially brain abscesses. And 3, tricuspid valve endocarditis and acute endocarditis. Here we go. Pneumonia. You will get a board question about pneumonia. Now the question is it a staph causing this pneumonia? Here are the clues. It's usually hospital acquired, and it's usually following a viral influenza. And it's going to be rapid destruction of the lungs, leading to effusion, which is escape of fluid into the body cavity, and empyema, which is pus filling the pleural cavity. That's the pneumonia that we're going to talk about when we're talking about Staphylococcus. Meningitis, cerebritis, and brain abscess. Symptoms are stiff neck, fever, headache, obtundation, which is altered level of consciousness, coma, and focal neurological signs. All these symptoms are same and similar to any meningitis. So if you get a meningitis patient or something like this, this is the exact same symptoms. The question is, you have to read the story, the vignette, very carefully to determine whether it's a staph causing this meningitis or some other bacteria or some other cause. So that's meningitis. Acute endocarditis. This is the violent destruction of the heart valve. Vegetation on the tricuspid. The tricuspid is on the right side of the heart. Vegetations are basically abnormal outgrowths. So you have abnormal outgrowth on the right side of the heart, which is the tricuspid valve area. You have a patient with fever, chills, myalgias, pain in the muscle, soreness in the muscle. Embolism from vegetation breaks off and can end up in the brain, causing a stroke, or in the lungs, causing embolism in the lungs, and usually the symptoms is difficulty breathing. And this is usually an IV drug user. So the IV drug user would inject himself into the vein. The bacteria on the needle will get into the blood system, end up in the heart, leading to the vegetations on the tricuspid, and of course damaging the heart valves. So that's acute endocarditis. So those 1, 2, 3. So these 6 diseases will show up on your board exams. Let's talk about the other diseases that can show up on your board exams if they're evil. Here we go. Osteomyelitis. These are children under the age of 12. You get a child under the age of 12 with osteomyelitis. Think this osteomyelitis is caused by hematogenously, which means that it originated from the blood. So this bacteria was in the blood and it traveled to the bone, causing the osteomyelitis. The patient usually has warm, swollen tissue over the bone and fever and shakes. So if you see a patient like this under 12 with osteomyelitis, think staph infection. Septic arthritis, number 5. It's actually with acute osteomyelitis and arthritis. But this can be both pediatrics and geriatrics. And the key is to the synovial fluid. When you see the synovial fluid in the joint area, you stick a needle into the joint area, draw it back, you will see that the fluid is yellowish turbid, which is cloudy, and elevated with neutrophils. You see this, you know that it's going to be a staph infection right away. All right, skin infection, very quickly. Impetigo, which is a honey-colored, crusty, flaky, contagious infection around the corners of the mouth of children. You'll see a picture of this, hopefully, if they're not evil. Think staph infection. Cellulitis, it's a deeper infection of the cells in tissue. The key clues are hot, inflamed, shiny, swollen skin. Check a picture out of this and go from there. Abscesses is a collection of pus. Furnicles, fur being the key word, hair follicles. It's the pus-filled crater of hair follicles. Carbuncles, contiguous lesions communicating underneath the skin. Google a picture of this and you'll understand what carbuncles look like on a patient. So there you have it. If you like this video and you want more of these videos, please click subscribe. Thank you and have a nice day.
She is a good student, but instead of just reading textbooks late into the night, Jennifer uses technology to help her study. She also watches lectures on YouTube and practices her knowledge with QUPI, a medical quiz app and online platform. Jennifer likes QUPI because it has 10,000 practice questions covering her entire medical course. This means she can practice her medical knowledge from anywhere and in a way that actually prepares her for the exams. Begin your 7-day free trial with QUPI today.